I get to start with the easy part, which is the heart scans, and then transition into the hard part, which is the diet and exercise. I was checking the tables just to make sure there weren't any projectiles or anything out there that might get in my way. When we talk about heart disease, you have to understand that heart disease is the #1 killer of men and women. At least in this country, more people are dying from heart disease every year than people dying of all cancers and chronic lung diseases combined. And that's why it's so important. It's estimated that about every 40 seconds, a person has a heart attack in this country. How do we change that statistic? How do we make a difference there? And that's what I'm going to spend a little bit of time talking about today. As I'm going through this conversation, I want you to ask yourself this question: am I at risk for heart disease? Because I think that's a really important question to decide who we need to worry the most about. Sometimes it's easy. Sometimes you can look at somebody and say, yeah, I'm not surprised they have heart disease. But other times it's not so obvious. So how do we decide who is most at risk for heart disease? We have a certain set of risk factors that we know increase your risk for heart disease. I like to divide them into 2 groups. Things that we can't control, which you see sort of in this purplish color on your left. Can't change the fact that you get older every year. I can't change the fact that you may be a man or a woman. And I can't help what you may have inherited from mom and dad. But then we look at the other side, this green side. What are the things we can control? High blood pressure, smoking, diabetes, physical inactivity, obesity, and high cholesterol. Those are the risk factors that I want to go through with you today in a little bit more detail. When you look at this circle here, and if you're ticking off all the ones as yep, got that one, yep, well then that's pretty obvious. We all can probably recognize that you're high risk for heart disease, but sometimes it's not so obvious. I'm going to throw out just a couple of other risk factors that perhaps maybe people aren't quite aware of. For the women in the audience, when you had your babies, you had your first stress test. If you had any pregnancy-related complications like high blood pressure, preeclampsia, eclampsia, or preterm delivery, you kind of failed your stress test, and you might be at higher risk for heart disease. Certain autoimmune conditions are associated with earlier heart disease, and we're finding that as more and more people survive cancer, some of our cancer treatments are actually increasing people's heart disease risk later in life. And like I said, well, I didn't say this yet. When we talk about these risk factors, not all of them are equal. Some of them increase your risk even more. For example, if you're a smoker, you're 7 times more likely to have heart disease than somebody who doesn't smoke. If you have diabetes, 5 times more likely. And if you're obese, 3 times more likely to have heart disease than, say, your counterpart who is not obese. So what do we do if it's not so clear? Maybe you do exercise and you live a pretty healthy life, but maybe you have a horrific family history. And that's a little bit harder to tease out. So what do we do? How can we decide if you really are low risk or perhaps you're more high risk for heart disease? And I think that's where the heart scans are most beneficial and most helpful. So let's take a moment and talk about what is a heart scan. It's a special type of CT scan through your heart. The whole test takes just a couple of minutes. It probably takes longer to walk into the building, answer our questions, and then walk back out. But what you do, you lie on the table, no IV, no contrast dye. The table slides you in the tube and then slides you right back out and takes pictures through your heart. If you decide to get a heart scan, wherever you go, you'll walk out that day with a piece of paper. And that piece of paper will give you a calcium score. We are quantifying the amount of calcium buildup in your heart arteries. Well, what does that mean? Why do we care about calcium? We know that heart disease is a progressive process. We have been able to identify the very beginnings of cholesterol and plaque buildup, starting in adolescence and even young adulthood. That's when it's actually starting. And then if it goes unchecked and uncontrolled, you end up on the other end of the spectrum here, where you see really tight clogging or even heart attack. It really doesn't do me a lot of good to see you when you're down here. Yeah, I'm going to help you not have another problem. But gosh, I'd sure love to be able to find you sooner so I can keep you from becoming part of that problem, becoming part of the statistics that I mentioned earlier in my talk. And that's where calcium comes in. The only way you get calcium in the arteries around your heart is if you had plaque or cholesterol build up there first. Plaque deposits as sort of soft and squishy cholesterol at first, and our body, in an effort to try to control the process, hardens it, turns it into calcium that these heart scans can pick up on. You can see, well, the words are a little small, but if you see my mouse here, this is the beginning of the calcium process. So if I find that you have calcium built up in your heart arteries, I can identify you much earlier in the disease process. We can make changes and perhaps protect you from moving downstream to having an actual cardiovascular event or problem. So what is a normal calcium score? Well, normal 0. You shouldn't have any calcium in there. To put in perspective, a score of less than 100, I would consider a mild amount of calcium. Sort of 100 to 400, a medium or moderate amount of calcium. And over 400, I've got red flags and alarm bells going off. Once your score gets over 400, you're more likely to have significant blockage, more likely to fail a stress test, for example. The higher the score, the higher the risk. If you have a calcium score of 0, your chances of a cardiovascular event over the next 10 years is less than 2%. If you have a score of 100 or less, you're 2 times more likely to have an event when you compare yourself to somebody with a score of 0. And if you have a score over 1,000, you're 12 times more likely to have a problem than somebody who has a score of 0. So the higher the score, the higher the risk. So how can your heart scan be helpful to you? Well, again, I think it can really help you reclassify your risk. Are you low risk, or perhaps you were under-recognized and perhaps you are more high risk and we need to be more aggressive with you? It helps me identify a higher risk individual earlier and helps me know who I can help be healthier so that they don't become part of that statistic. For you individually, sometimes I find that these heart scans serve as a motivating factor. It can perhaps be the impetus that gets you to actually make the changes that probably should have been doing all along. And get aggressive with risk factors. Maybe you finally are ready to make those lifestyle changes that your doctors have been talking to you about. And in some cases, medical therapy may be necessary.
What kind of medical therapy? Do you need medicine?
Yep, and I'll come back to that in just a minute, I promise. So you go get your heart scan, you walk out with a piece of paper and it's not 0. You have calcium buildup, so what do you do now? Well, I think we go back to those risk factors. Assuming you're not having any symptoms or problems, it's an opportunity to make changes. Remember, there's things we can't control. But gosh, if you have an abnormal calcium score, I can be sure I'm going to make sure your blood pressure is well controlled, your cholesterol is well controlled. If you're smoking, I'm going to do everything I can to help you stop smoking. If you don't have diabetes, we'll try to protect you from developing it, or if you do, we'll make sure it's really well controlled. If you are physically inactive, we'll start exercising. And if you are obese, we're going to try to get you back to a healthy weight. That's how you take control over your cardiovascular destiny, if you want to call it that. That's how you prevent yourself from becoming a statistic. We control what we can control, okay? I want to take a moment and talk about 2 risk factors specifically that you guys, in a day-to-day basis, can control. The 2 things that you can do for yourself to take power back over heart disease. And that's obesity and physical inactivity. Segues nicely into the diet and exercise portion of my talk. When we talk about nutrition, I really hate the word diet, but when we talk about nutrition, there's so much out there. There are so many fad diets that have come and gone. I just put a few in there. It's all about the keto diet right now. Everybody wants to talk about that. But there's so much in there. And you have to remember that, and like I said, a diet is a diet is a diet. And I think every diet out there has its strengths and has its weaknesses. I think when you approach a nutrition plan or a diet, you have to understand what your personal goal is with that diet. If it's to lose weight, then there are diets that are amazing at weight loss, and you will lose weight. But if your focus is really improved cardiovascular health, then I want to make some suggestions there. I want you to consider this. When we talk about improving your cardiovascular health, when we talk about nutrition that's going to help your heart, there's a couple of studies. It's a really hard thing to study is diet. There are a couple of nutrition plans out there that I think offer the best chance to help you. A few years ago, they studied the Mediterranean diet, and they took pretty high-risk people and asked them to follow this diet, and they actually did better. They had fewer cardiovascular events. And so I've included the Mediterranean food pyramid here, okay? With these two suggestions here, I'm hoping I can give you an idea of how to approach your day-to-day diet and nutrition choices. Everybody has their own set of challenges when it comes to nutrition. You have your own set of health problems that might dictate what you can and cannot eat. Everybody here has their own weaknesses and indulgences. Everybody has their own day-to-day life, busy schedules that sometimes dictate what food choices we make. When we look at this Mediterranean food pyramid, I want you to look at the bottom. And I want you to see that there's a lot of green leafy vegetables in there. We talk about nuts, beans, legumes, seeds. I want you to look at the top. That's where the meats and sweets are. I want you all to think about how you eat. And I suspect a lot of us in this room, the pyramid's probably flipped. And I think that's pretty common in our Western society. We really need to be thinking about what should go on the bottom of the pyramid, much like you see here. And if you're looking for something that actually has proof behind it, proof to actually help you do better, live longer, and have less cardiovascular disease, this is what it looks like. Now look at the picture on your right. Again, you see a pretty similar pattern. Of all the nutrition studies that are out there, the type of diet that has the best chance of reducing your cardiovascular risk is a plant-based diet. Now, I can't ask everybody to become a vegetarian. I know that's not right. But I do think we need to rethink vegetables in our diet. And I think that is probably the biggest thing we lack in terms of good nutrition for cardiovascular health. I think we need to think about creative ways to have different proteins rather than meat-based proteins, but plant-based proteins, adding that to our diet. For folks that come and see me that really have a lot of work to do in terms of diet, I ask them to try one thing. Every meal that you sit down to, I want you to look at the unhealthiest thing on your plate, take it away, and put a vegetable in there. Just start there. Don't change anything else. You guys have been living a certain way for 30, 40, 50, 60 years. You're not going to change overnight. I know that. But I think we all need to get more used to the idea of vegetables being a main part of our diet. Plant-based products is a better part of our diet to improve our cardiovascular health. Now, it's a little bit more than just diet. When we talk about obesity, weight management, physical inactivity is a huge component of that. And what I've found about exercise, I have a feeling I'm telling you guys everything you've already heard and probably already know. But what I found about exercise is it's really about consistency, okay? It doesn't really matter what you do per se, but you have to commit to it on a regular basis, 5 days a week. I know that sounds like a lot, but that's really what it takes if your motivation is to improve your cardiovascular health. So what is good physical activity? Well, it's about 30 minutes a day, 5 days a week of sort of moderate intensity activity, and I'll come back to that. If you are able to exercise more vigorously, then you can get away with shorter amounts of time, 25 minutes a day, 3 days a week. I'd like to throw in there and comment on this muscle strengthening that's also recommended 2 times per week. I find that, especially as we get older, this muscle strengthening component is a really important part of helping us maintain a healthy weight. I find that as we get older, just the cardio type-based fitness programs don't do as good of a job. I really think you need to have some strength training, whether it's with weights or body weight exercises to help you maintain a healthy weight. Never mind all the other health benefits as we get older and keeping our muscles strong around bones that might be starting to weaken. The other thing that's important to know is that it's never too late to start exercising. There are so many health benefits. I promise you, you'll feel better. But I really think it's about commitment, and I hear it over and over again. You exercise a couple days here, a weekend there, and then you come back and see me and you're frustrated that you haven't lost any weight or you don't feel any better. We have to find a way to just make it part of our day-to-day life, like brushing your teeth. Did I get my 30 minutes of exercise today? Do you have to join a gym? No. You don't even have to get on a treadmill if that doesn't speak to you. It's really just about moving, getting out, doing something. To give you an idea of what I mean by moderate intensity, walking about a 20-mile or 20-minute per mile pace is a pretty moderate intensity activity. Water aerobics, especially if you have joint issues, is a great way to get some exercise. Bicycling at a slower pace, ballroom dancing, general gardening. Those are all fine. For more vigorous intensity activity, if you speed walk, jogging, running, swimming laps, cycling at a faster pace, about more than 10 miles per hour, aerobic dancing or heavy gardening like hoeing or raking, those types of harder gardening activities. So I hope that gives you some perspective on what I mean by moderate versus vigorous. For moderate intensity activity, you should be saying to yourself, yeah, this is kind of hard, and that's going to be moderate intensity. If you're doing it and you're saying, whew, this is really hard, then that's your vigorous intensity. So you have this abnormal calcium score. You're going to make changes on your day-to-day life. But sometimes it takes more than that. Sometimes it requires medical therapy to help control the disease process. It's one of those risk factors that we can control. It's something we can offer you to help protect you from heart disease. I'm not going to talk too much about statins because I know that talk's coming up. But I just ask that you be open to the discussion with your doctor about whether statins are appropriate for you if you have an abnormal heart scan, because I'm sure it will come up in your conversation with your doctor. So what does ideal cardiovascular health look like? Who do I not have to worry about? It's somebody with a total cholesterol less than 200, a blood pressure less than 120/80. You don't smoke. You maintain a healthy weight. Your blood sugar is less than 100 when you're fasting, and you follow a healthy diet with good physical activity like I mentioned. That's the goal. And I think I behoove you all to really make it a priority for your own health. Like I said in the very beginning, the statistics are there. And this is how we change the nature of heart disease and change that statistic in the future. So just to summarize a couple quick things. Heart scans offer a way to detect heart disease earlier. There are at least 10 different St. Vincent locations around the state where you can get a heart scan, and I've included the link for you here. You can schedule your appointment online. You might consider talking to your doctor if it makes sense for you. It's not for everybody, but it may be appropriate for you. And I would encourage you to see an abnormal heart scan as an opportunity. Allow you to, again, control what you can control. Remember that healthy habits are a way you can make a difference on a day-to-day basis. Please remember there's no magic diet. Every diet has their strength. Every diet has their weakness. I really think it's about incorporating more vegetables into your diet. Remember that exercise is about consistency, commitment, and that statins can protect from heart disease, so be open to that discussion.